On this episode, we'll talk about bleeding disorders and getting weight loss surgery. We'll also talk about menopause and your weight loss. And we'll talk about pain in your butt after losing weight. Hello everyone, I'm Dr. Alvarez with Bariatric.com and welcome to episode 258 of the Ask Dr. A Show. Thanks so much for joining us. And if you are new to the show, you can always send me your questions. There's one way, is either comments down below or wherever you're watching this episode. Use the hashtag Ask Dr. A. That way we are able to grab those questions. And maybe consider subscribing to our channel. That way you don't miss out on future episodes. All right, so let's get into the show. Okay, so the first question is, Doctor, I want to know if I am eligible to have weight loss surgery if I do have a bleeding disorder. Well, there are many types of bleeding disorders, and it is important for you to notify your surgeon the type of bleeding disorder that you have, if it's under control, under surveillance, and most certainly your doctor, your surgeon will ask for clearance by your doctor that is seeing you for this condition, the bleeding disorder condition, so you are cleared to have or to proceed to have weight loss surgery. We have done it 1,000 times. It is quite normal, and we even sometimes get certain instructions from your doctor letting us know how to manage your bleeding disorder during, during, or post surgery regarding your bleeding disorder along with your weight loss procedure. So yes, we would need clearance by your doctor to proceed with weight loss surgery. I know back home or wherever you're watching this, they will ask the same thing. So the second question is, I want to know more about weight loss after menopause, because in this case, this woman is having a harder time losing weight with her weight loss procedure, and she's going through menopause. Is this normal? Oh yes, this is quite normal. This is quite expected, I might say, because once you hit menopause or that age range, your body starts to change, your hormones start forced to change, your estrogen lowers, your body composition changes drastically, all right? Just by nature, at that point, your body loses quite a bit of muscle mass, and let's say it gets substituted with more fat accumulation or fat storage. So just by nature, that losing the muscle, gaining fat in your body while you're trying to lose weight, it's difficult. So there are some things you can do. Definitely you can change your nutrition. That's why as bariatric surgeons, we're always pushing the protein. So focus on more protein intake, make sure you're well hydrated as well, and you're toning your muscles, you're exercising, and that should be enough along with your weight loss surgery to get you going with the weight loss. But it is okay to ask for help and touch base with your surgeon or even with your OBGYN to help you even further out. So there's always room for help here. And the last question is, I want to know if the pain in my butt is normal after I've lost so much weight. And the answer is, it is quite common. Yes, that's why it's here on the show. So having some pain in your butt after you have lost 50, 60, 70, 100 pounds or more is quite common because let's say your natural cushion, your butt at that point is decreased, and those pressure points makes it a little uncomfortable. Normally, this is temporary. As you lose the weight, you plateau and you go into this phase called the fat redistribution phase. It goes back and you have that extra cushion, maybe not as it was initially, but it helps. During that time, there are some things you can do. Of course, try to look for some cushions that alleviate those pressure points, and maybe not being in the same sitting position for prolonged periods of time, etc., will help you. But this is normally temporary. Again, sometimes the fat redistribution helps, but sometimes it never comes back to original starting point. So help yourself. This is quite common. Let's say it's a very small price to pay if you lost 70, 80, 100 pounds. All right, so there you have it. That is it for episode 258 of the Ask Dr. A Show. I'm waiting for your questions, and if you enjoyed these questions, if you can please give it a like, I greatly appreciate it. Maybe share this episode and consider subscribing so we can hang out again. I'm Dr. Alvarez with EndoBariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.